Good afternoon. My name is Hu Xing.
Bleeding is a frequent medical emergency. From minor cuts to severe trauma, it can lead to complications like infection and excessive blood loss. Knowing how to control bleeding can prevent severe outcomes and save lives. This guide provides essential techniques and tips. Capillary bleeding is slow and oozing, often from minor scrapes or shallow cuts. Clean the wound and apply light pressure with a bandage. It usually stops on its own. Venous bleeding has a steady flow of dark red blood, typically from deeper cuts. Apply direct pressure and elevate the injured area to reduce blood flow. Arterial bleeding is bright red and spurts out, often from severe trauma. Use direct pressure points, or a tourniquet if necessary. Immediate action is crucial. Ensure both you and the victim are safe from further harm. Wear gloves, if available, to prevent infection. Weekly assess the type and severity of bleeding to choose the appropriate treatment method. Use sterile gauze or clean cloth to avoid introducing bacteria into the wound. If bleeding is severe or does not stop, call emergency services immediately. Direct pressure is effective for most cuts and wounds. Place a clean cloth or gauze over the wound. Rest firmly with your palm for 510 minutes without lifting. Add more layers if blood soaks through. Secure with a bandage once bleeding stops. Elevate the limb for arm or leg bleeding. Keep direct pressure on the wound and raise the limb above heart level to reduce blood flow. Do not elevate if a fracture is suspected. Use pressure points if direct pressure fails. Such as with arterial bleeding, identify major pressure points. Brachial artery for arm bleeding, femoral artery for leg bleeding, and press firmly between the wound and the heart to slow blood flow. Tourniquets are a last resort for uncontrolled bleeding, such as amputations or deep gashes. Use a wide band 23 inches or commercial tourniquet. Place it 23 inches above the wound. Never on a joint. Tighten until bleeding stops. Note the time max 2 hours and seek emergency help immediately. Use a cold compress for internal bleeding. Bruises, but not open wounds. Wrap ice in a cloth and apply for 15-20 minutes. Repeat every hour to reduce swelling. Sit upright and lean slightly forward. Pinch the soft part of the nose for 10 minutes. Apply ice to the bridge of the nose. If bleeding persists, do not tilt the head back. Scalp wounds may bleed heavily, but are often less severe. Apply firm pressure with a clean cloth and watch for signs of concussion, such as dizziness or nausea. The symptoms include swelling, bruising, abdominal pain, and vomiting blood. Call emergency services immediately. Keep the victim still and monitor breathing. Rinse the wound with clean water or saline. Disinfect around the wound with antiseptic iodine, but not inside the wound. Cover the wound with a sterile dressing and change it daily. Watch for signs of infection, such as redness, pus, or fever. Do not use dirt, ash, or unsterile items, as they can cause high infection risk. Removing embedded objects can worsen bleeding. Even minor cuts can get infected if not properly treated. Delaying medical help for severe bleeding can be fatal. Call emergency services if bleeding does not stop after 10-15 minutes of direct pressure. The wound is deep or caused by a dirty object. Signs of shock occur: pale skin, rapid pulse, confusion, or if internal bleeding or head injury is suspected. Direct pressure is the first and most effective step in bleeding control. Elevate the injury if possible to reduce blood flow. Use tourniquets as a last resort for severe bleeding. Always seek professional help for serious wounds.
Now let's watch to video.
减少出血。2. 在要绷扎的部位垫上宽而柔软的敷料或毛巾。3. 在受伤肢体的近心端绷扎及上臂的上1/3处或大腿中部。4. 左手拇指、食指、中指捏住橡皮带的头端，右手将橡皮带拉紧，绕肢体1圈后压住头端。5. 再绕1圈，用左手食指、中指捏住橡皮带尾端。6. 左手将尾端从肢体上的2圈橡皮带下拉出一半，形成一个活结。7. 4. 手、前臂、上臂中至下端出血。弓动脉止血法：一手握住伤员伤肢的腕部，将上肢外掌外旋，并曲肘抬高上肢，另一手拇指在上臂肱二头肌内侧沟搏动处上臂中线位置，向肱骨方向垂直压迫。